Hey guys, Veteran Outdoorsman here. Um, and I did a video a while back about treating some minor field injuries, and I did some how-tos and things like that. Go back and look up that video, please. Today's just going to be a discussion. I do a lot of discussions. It's not going to be so much a how-to, but of some things that you need to be aware of, some things you need to know that you can do or know how to do. Look them up, whatever to treat injuries that you may come across while you're in the field. Um, Common injuries in the field: sprains, strains, breaks, lacerations. Um, in simple redneck terms, pulled muscles, twisted limbs, broken bones, and cuts. Uh, Bruises, things like that too. Not much you can do to treat that, but things to be, just things to be aware of. Heat injuries are a big thing. Heat and cold injuries are a big thing as well. Um, Very easy to become a heat casualty while you're out hunting, even in cold weather, especially in cold weather, actually, because we forget to hydrate. We don't think about exerting and sweating and things like that. And many times are already partially dehydrated when we go out. So, a little bit, I touched a little on an earlier video of preventing injuries with proper hydration and things like that. So, I'm just going to very easily, before you go out, hydrate the night before, several days before, whatnot. Make sure you're properly hydrated. Make sure you take plenty of water with you. I know that's extra weight, but it can save your life. Hydration is a big deal. Hydration can also help you cut down on injuries, can help with inflammation, strains, things like that. Keeps your, water is the majority of what your body's made out of. It cools your body, it lubricates your joints and things like that. That's something that you need to stay hydrated. That will help prevent heat injuries, heat exhaustion, heat stroke. Um, Being properly hydrated can even help with sunburns and things like that, believe it or not. It won't keep you from getting sunburn, but it can keep the severity down because your body is cooling properly. Um, so think about those things. Sprains and strains. We've all gotten those over the years. You severely twist an ankle and you still have to get out of the woods. What do you need to do? Look up how to stabilize a sprained ankle. Practice these techniques. You can use splints, ace bandages. Carrying an ace bandage, something like that in your pack is not going to add a lot of weight, but it can really help if you get injured. You twist your knee or something like that. Carrying an ace bandage with you can significantly help. Some athletic tape or medical tape can really help in those cases. That's sprains and strains. What about breaks? You fall can be a minor break from a broken finger, a broken toe, to a large break, a broken arm, a broken leg, a broken rib, something like that. For broken ribs, ace bandages or tape can be very beneficial to wrap your ribs, to keep everything tight. You want to be very careful when it comes to broken ribs. If you know you've got a broken rib, because you don't want to puncture your lung. You don't want to move a rib and puncture your lung. You need to be very careful when it comes to things like that. Many times we'll strain or dislocate ribs. Some wrapping can help significantly with that. Look these things up, learn how to treat these injuries. A broken leg, a broken arm. Know how to make a sling. Some of my other videos I talk about making splints and slings. Look that up. There's lots of good information out there, field medical manuals, things like that that you can carry with you. Learn how to make slings, learn how to splint broken bones and things. Materials that you can use, from arrows to sticks, whatnot, to make splints. That can be very helpful. Your shirt, your pack, something like that can be used to make a sling. Um, when suffering from a shoulder injury or something like that, I've many times, you can tape your arm to your chest to immobilize it. Tape your wrist or your hand to your chest. Just stick, if you've got a button-up shirt, stick your hand in there like that to keep it somewhat immobilized. You break a finger, tape it to your other finger. Same with toes. I've always got duct tape with me when I'm hunting, or electrical tape, one or the other, or both. Those can be used in a pinch. Medical tape is a good idea, something to carry with you. Tape up broken fingers, tape your hand to your chest, like I said, to immobilize it. You can make a sling with a shirt or with a piece of a tarp, cloth, something like that. Just a piece of a ratchet strap, make a loop, tie it around your neck, sling your arm through it. Can be very helpful if you're injured. Let's talk about cuts. You need to learn the difference between an arterial bleed and a vein bleed. An arterial bleed is fairly simple, but do some research on this. Don't just take my word for it. You'll see a pulse. The blood will come out in spurts. It won't necessarily shoot out, but it'll flow, then it won't, then it'll flow, then it won't, it'll flow, then it won't. That's an arterial bleed. That is something that you, on a smaller artery, a small laceration, something like that, you may be able to stop with direct pressure, with pressure dressings, things like that. It may require a tourniquet. Learn how to apply a tourniquet properly. Learn how to stop bleeding. Learn how to recognize concussions. If you bump your head and lose consciousness, you've had a concussion. You get severe headaches after you've hit your head, you've thrown up. Those are signs of concussion. Treat yourself as if you've had a concussion. Hydrate, rest, etc. Look those things up. What do you do if you've had a concussion? Many times you're going to be out in the woods by yourself. You're going to need to treat yourself somewhat before you get out of the woods. Carry things that can be used as tourniquets, or carry a tourniquet, a cat tourniquet. I've got one that I had in the military. It's a simple device. It's got some Velcro. You strap it around the limb that needs the tourniquet on it. It's got a stick. You twist it around a couple times, tighten it. It's got another piece of Velcro. It holds the stick in place. But you can use a stick, an arrow, or something like that, and your belt, and you twist it around until the bleeding stops. Tape it in place, tie it in place, etc. Learn how to apply a tourniquet. Something that you need to do if you ever have a severe bleed and you have to apply a tourniquet. You've already lost a significant amount of blood. You need to stay hydrated, things like that, to try to get your volume back up. But one of the first things you need to do after you've applied that tourniquet is on your forehead, on your chest, somewhere that's going to be very visible, put a T and the time it was applied. Write a note, tape it to where the tourniquet is, whatever. You've lost blood. You may lose consciousness. You may be incoherent by the time you're treated by a medical professional. They need to know when that tourniquet was applied. Because once all that blood is cut off, your muscles begin to die, and you've only got so much time to save it. They need to know when that tourniquet was applied. Do not listen to the old adages of you loosen it every sew off and things like that. Once you tighten it, leave it on. But, you know, the old thing in the army would take the blood, write a T, put a time on it. You can use an ink pen, a Sharpie, whatever. Make sure somewhere very visible on your body, on the tourniquet, whatever, there is, a T on your forehead is a big deal because then they know there's a tourniquet somewhere. And a time, write the time when it was applied on the tourniquet itself, on your forehead, whatever it is, because you may not be conscious or coherent by the time you're getting treated, and they won't know how long that's been applied. That may save your limb, it may save your life by doing that. Sprains and strains are very common. Cuts are very common. Fall injuries are very common. Those are the most common severe injury when hunting is fall injuries from tree stands, from hills, from cliffs, things like that. Falls are very common. The most common occurrence of serious injuries. Learn how to make splints. Learn how to properly apply an ace bandage. Learn how to properly apply a bandage. I mentioned this in other videos. Here's an instance where I got injured and had to treat myself before I got to a doctor. I was a good hour or so from any hospital, medical facility. I'm field dressing a deer. I'm cutting through the brisket that I've done many times before. The knife slips. I hit my hand. If you look real close, you can see a scar here. I cut all the way to the bone. Ended up with 5 stitches later on. Well, I had to stop the bleeding somewhat because I had to get to a medical facility to get treated. I couldn't just be bleeding all over. Had to drive, had to get the deer out of the woods, had to drive an hour or so to get to the hospital, etc. So I used a clean bottle of drinking water. I irrigated the cut. Had I had some peroxide or something, I would have cleaned it out with that, but I didn't have that on me. I used the cleanest cloth I could find and dried everything off, and then applied, I think I had some napkins, and I put that over it in the place of, say, gauze or something like that. You use a clean piece of cloth, whatever, apply it over that, put some pressure on the wound too, then put tape over it, duct tape for a bandage, and then, because you're moving your thumb all the time, and that'll open it back up, you wanted to immobilize my thumb. So then I put my thumb like this and taped it to my hand so that I couldn't move it. And that allowed me, I also, as I was taping everything up, I closed the wound the best I could to help staunch the bleeding. Taped everything up, and then drove an hour. I got home, had my wife take me to the urgent care, and I got stitched up because by the time I had got the deer out of the woods, driven home, etc., I was in a considerable amount of pain and didn't need to be driving anymore. Probably shouldn't have been driving to start with, but I didn't have much of a choice. I had my wife take me to urgent care. We got me stitched up. Just because you know how to treat some injuries, don't take for granted that they're just what you think they are. Treat them in the field, that's fine. Then get your butt to a doctor and get checked out. You may think you've got a bruise, it may be a fracture. You may think you've got a sprain, it may be a torn ligament, it may be a fracture. Um, you may think something's a minor cut and you don't need stitches. It's not a bad idea to just get it checked out, especially if it's fairly deep or fairly long. Um, you know, when I cut my thumb, I did the basic checks. Can I move my thumb? Can I feel a pulse? If I push on my fingernail, does the blood come back into it? Things like that. I want to make sure I didn't cut a major vein or artery. Try to make sure I didn't cut tendons, things like that. Did a little bit of triage so that I can give the doctors the most information possible. Told them exactly how I injured myself, etc. In the case of cuts and blood loss or a head injury, something like that, take some notes. I always keep some sort of a notepad or something in my pack. Take notes, write things down. This is how I injured myself, etc. With a head injury or with blood loss, again, you may not be coherent. You may not be conscious by the time you're getting treated. If you've got that notepad or, tape it to the injury site, something to give the doctors as much information as possible. And even if it's something embarrassing, tell them every detail of how the injury happened. I'm standing on a little embankment looking over a creek. I'm peeing. A rock slipped out from under my feet and I fell 6, 8 feet, 10 feet and bumped my head on a rock. Tell them exactly what happened because they need to know what position your body was in, things like that, to get an idea of what other injuries to look for. You are going to be conscious of the most severe injuries. The big knot on the back of your head, the arm that bends this way when it's not supposed to, things like that. But you may not be conscious. You also tore a ligament in your ankle, but you weren't paying attention to that because your bone's sticking out of your arm. Things like that. Give them all the details you can. Again, write it down, tape it to the injury site, exactly what happened in case you're not conscious when you're being treated. And that way they can treat your injuries as best possible. You fall from a distance, you bumped your head. They need to also look for broken bones, for large bruises, for cuts, for busted ribs, things like that. Spinal injuries, things like that. Many times when you have a head injury, you could also have a spinal injury because you bump your head and it whips around and whatnot. Things to be very, very conscious of. If you've ever bumped your head and lost consciousness, you have to get treated as soon as possible. You could have bleeding or swelling on your brain. You have to get treated. Obviously, with breaks, with cuts, but things as simple as sprains and strains. You cannot see inside your body and know exactly what happened. You need to get looked at. I know with pride and things like that, or maybe we're scared of the cost of a medical bill. Well, you know what? A doctor's visit's probably cheaper than a funeral. A cast or some stitches is cheaper than an amputation later on down the road. We get this pride in ourselves. We've got a small cut on our foot or on our leg or something like that. You think, well, I'll just put some tape over it or some super glue or something like that, and I'm fine. Well, then it gets infected. Maybe you get blood poisoning from it or something like that. It can become something very minor, can become very serious. There's people that have lost their foot or their leg because of ingrown toenails that they didn't get treated and they became infected. Same with their fingers, their hand. Because of small stuff, they didn't get it treated properly, it got infected and it became worse. People have lost their lives from blood poisoning from really small cuts. If your tetanus shot's not up to date and you got a cut, go get a tetanus shot. Tetanus is very easy to prevent, but once it sets in, it's not the easiest thing to treat. Go get you a tetanus shot. Make sure that's up to date. That was, one of the first things I told him when I had that cut on my hand was, it's been over 10 years since I've had a tetanus shot. I need a tetanus shot. Okay. So they put that down. I get my tetanus shot. I got my 5 stitches. They put me on antibiotics because I told them exactly what happened. I was field dressing a deer, which is a wild animal. So the wound was contaminated with animal blood and potentially dirt or bacteria, whatever that may be on the deer's body. They're dealing with an already contaminated wound. They cleaned and irrigated it. They stitched it up. They put me on 10 days worth of antibiotics to stave off any infection that could have possibly happened from that injury. I healed up very quickly. 10 days later, I got my stitches out. There was no visible swelling, no pus, nothing like that. And I was good to go. I healed up well. Had I not told them how I was cutting something, I cut my hand, blah, 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 maybe they wouldn't have put me on a long series of antibiotics. If I didn't tell them when my last tetanus shot was, I wouldn't have got a tetanus shot. I could have gotten tetanus. If they didn't put me on the antibiotics, I could have gotten a bad infection. You have to tell them all the details. Again, even if it's something, this goes just with household things, even if it's something embarrassing. And I'll touch on some things that people won't want to say because they won't want to get in trouble. I'm not stupid enough to believe that everyone that's watching these videos follows every law on earth. I'm not that dumb. If you've been using any type of drugs, alcohol, things like that, you need to let them know when you get an injury, because the treatments that they give you could be adversely affected by any drug use, whether it be prescription or otherwise, or alcohol use. You need to let them know hey, I don't believe in drinking. I don't, I did drink a long time ago. I don't anymore. I don't believe in that. I don't believe it's right to use drugs or things like that. I'm not going to push my beliefs on you. I'm not stupid enough to believe that everyone watching this doesn't do things like that. If you do, don't be worried about getting in trouble. You have to let your doctors know. Well, before they're giving you pain meds, you were snorting cocaine last night. That could stop your heart, folks. I know that's an extreme example, but maybe you're somebody that deals with chronic pain and you take some sort of opioid periodically to deal with that. If you've taken one of those, they can't give you the pain meds more than likely, or they have to give you a smaller dose, something like that. Let them know you've been injured. When you're injured, your blood pressure goes up, your pulse rate goes up, things like that. If you start having a headache because of that, you need to take a notice of that. Even if it goes away, you need to let the doctor know. You start having chest pain, even if it goes away, you need to let the doctor know that happened. Because of your elevated blood pressure, things like that, you may be on the verge of a heart attack or a stroke. You need to let them know so that they can look for the cause of that. It may be the sign of a more serious issue. It may mean, you cut yourself. It may mean you get a blood clot floating around somewhere and they need to look for it. You get a small cut on your arm or your upper leg or something like that, and you get some numbness further down an extremity, you have to let them know that. You get tingling, numbness, just weird sensations, twinges, pains. You have to let them know. You may have damaged a nerve. You may have a blood clot floating around. You have a fall and now you've got some numbness. Maybe you collapsed a vein. Maybe again, you bruised something and you get a blood clot floating around. You get some difficulty breathing because of your elevated blood pressure, whatnot. You need to let them know. Give every detail that you can give so that they can give you the best treatment possible. Get treated as soon as possible. Well, I want to go eat dinner first. I want to do this. I want to do that. Get treated. Get treated. Stay hydrated. That makes a big difference in recovery, blood loss, etc. Makes a big difference. Know how to make splints. Know how to properly apply bandages, tourniquets, splints, ace bandages, different types of wraps. Know how to immobilize. Take an emergency first aid class. Things like, take your your simple first aid classes. You get a chance. Many times you get to take them for free at work. Take that class. Even if it means staying late or coming in on a Saturday or something, do that. Take a field medicine class. There's lots of emergency things, just basic first aid, stuff like that. Keep a first aid pack around. Keep some simple things around. Some medical tape, some duct tape, some gauze, some sort of an antiseptic, alcohol, iodine, peroxide. Learn how to make a tourniquet out of a belt or out of a ratchet strap or a tie down, something like that. Practice doing these things. Study up on basic field diagnosis of certain injuries. It could save your life or the life of somebody else. It could certainly save a limb, save a lot of just trouble down the road. Injuries are serious no matter how minor you think they are. They need to be treated. And if you're out by yourself or just with a buddy or two, whatever, you're out in the wilderness a lot, you need to know how to treat minor injuries. And you need to know warning signs to look for. Chest pains, headaches, numbness, tingling, things like that. You need to know the difference between a vein bleed and an arterial bleed. Signs of a concussion. You need to know these things. It could save your life or the life of someone around you. And if you're watching this video and you think, well, that's never going to happen to me, or I'm always with somebody and someone else is going to know how to treat it, you're a danger to yourself and others. You need to just stay home. You need to know how to do it yourself. Take a CPR class, learn the basics. Watch some videos, practice making splints, slings, things like that. Get your muscle memory build up so you know how to do it. Here is an instance. I was in a medical unit in the Army, though I was not a medical MOS. But because of that, we had to take certain classes because I was in a medical unit. And many times we would be used to help with triage, to take patients off helicopters, things like that. So we had to take certain things. We had to take what's called a combat lifesaver class, which was how to do needle decompressions. One of those classes we learned how to do a crike where you open an airway in a guy's throat. We learned how to put in nasal trumpets, different ways to open nasal trumpets, mouth trumpets, different ways to open airways, things like that. We learned how to apply tourniquets, how to put in IVs, various methods of stopping bleeding, pressure dressings, direct pressure, basic bandages, improvised bandages, etc. We had to learn all that. We also had to take a CPR class, which also included some basic first aid, how to use a defibrillator, an automated defibrillator, not one of the hospital style ones, an automated one, things like that. Um, those are big skills to learn. Those are big deals. Those are things that if you ever get a chance to take those classes, you need to take those classes. You need to learn these things. My daughter was probably around a year old. She's eating solid food. We're sitting at home. I'm a first time parent, a fairly new parent. Like I said, daughter's about a year old. Me, my wife, my daughter are in the living room. My daughter's chewing on a roll, or some sort of bread. I don't remember what it was. Well, as kids tend to do, she bit off more than she could chew. She swallowed it. She started to choke. She is obviously in distress. She wasn't turning blue yet or anything. She's obviously in distress. My wife freaks out. RJ, she's choking. She's choking. She's choking. Maybe she wasn't. She was less than a year old. Whatever. Anyway, but she's eating some solid food. Anyway, I grab her, hold her upside down, give her the quick thrusts on the back. She spits out the bread. She starts breathing again. She's crying, screaming her head off, but that's good. She's making noise. She can breathe. Hold her, calm her down. Had I not known how to do that, my child could have died. At that point, I showed my wife. We took a baby doll. We practiced because my wife just didn't know what to do, or she froze. I really don't know. So we went through that. If this happens again, this is what you do. We took one of my daughter's baby dolls and we practiced. And I showed her exactly how firmly to hit and whatnot, where to. So if that happened again, if I'm not home or whatever, she knows how to take care of it. You need to learn these things. You may be the only person. Hey, you may have to treat your own injuries. When you learn how to do the Heimlich maneuver, they show you how to do it on yourself, leaning over a chair, things like that. And I actually, one time did have to do that to myself once. I was choking on a piece of a big dill pickle and had to lean over a chair and do that to myself. Because I just wasn't able to get the attention of somebody else that I was choking. And learn these things. It could save your life or someone else's. Well, hey, another instance. I can remember, geez, I wasn't very old, 6 or 7. I'm at home. Myself, my sister, my mom and dad were sitting at the table eating dinner. My mom starts choking. My dad tells my mom to stand up. He gets behind her. He performs the Heimlich on her. And he had to thrust several times. And finally, she spits out a piece of a pork chop or something. She starts breathing easier, etc. Hey, me and my sister, we're little. I'm 6 or 7, so my sister's 4 or 5. We didn't know how to do any of this. Dad did it. after that, he showed us how to do the Heimlich, how to do it on a larger person in case that happened to mom again and whatnot. Hey, this happened. Now let's show you guys in case it happens again and I'm not here. Go over it with your family members, friends, guys in the hunting club, in a hunting club, your hunting buddies, whatever. And if they're not willing to learn, maybe you don't want to hang out with them. Because if they're not concerned with their own safety or your safety, they could be a real detriment when something goes wrong. God bless you all. Like, subscribe, hit the notification bell, and we'll see you next time.